Humboldt Park is an old, traditional neighborhood. The hospital was founded in 1894. But in the last 20 years, we have seen the demographic of the community changing.
We're coming into a time here in Chicago where barriers and demographics and ethnicity is being broken down.
We felt and we feel that we needed to address that. It took us a great deal of time to arrive to the conclusion that we wanted to change the name.
So after a lot of deliberation on what the name change should be, one of the things that came up was whether this should be Humboldt Park Health or Humboldt Park Hospital.
We were very deliberate in saying we are going to call it Humboldt Park Health, not hospital. As a healthcare provider organization, if our mission is to improve that outcome, improve that health, we have to be looking beyond the four walls of a building.
Health represented a much bigger picture than just the hospital, a facility. This hospital reaches out to the community.
Our hospital is really about advancing health equity, which means really providing easy access to everyone.
The people in our community face many challenges: housing, access to food, access to transportation, access to affordable health care. All of those things that make up someone's life outside of a hospital.
Various communities and ethnicities are not getting the kind of care and service that they require.
Health inequities have been here in our country for a very long time. But this issue has been brought to the forefront of the conversation in our country, triggered by several factors. One is the pandemic.
When the pandemic first hit, the hospital was the bedrock and one of the first places where people were able to get treated. The doors weren't closed. We were encouraging folks to get tested here, to get treatment here. And what's happened since that point is it's expanded beyond into the community.
We really want the community to know that we're here for them.
The positivity rate for Hispanics and Latinos is significantly higher than for white populations. That's why we go into the community.
So community health workers play a key role to visit and go into individuals' homes and say, hey, how are you feeling today? Rather than actually waiting for people to come, we wanted to be more proactive and actually engage the community in their own setting.
Having that partnership with a community health worker that's actually out there meeting people and letting them know that we're here to help them and we can provide them with these services will have a great impact.
We've done drive-thrus, we've done senior citizen buildings. We want to make sure that we reach everybody in the community.
There is this willingness and understanding to do what is needed, not what is comfortable.
What I really love and I appreciate about Humboldt Park Health is that they actively are reaching out and engaging with the community to make sure that their mission's accomplished, which is serving that community.
We have established a food pantry. We've been providing upwards of 300 plus bags of food to the community a month. I worry about it every month, are we going to run out of food and somebody's going to come in and they're going to need food. We try to make sure that we meet every need we know we have in the community.
Every person counts. So this event really represents how important it is for us to, provide that outreach to the community.
I think advancing health equity today is really focusing on individuals' needs that has been long neglected by all of us as healthcare professionals.
The future of healthcare is not just in a doctor's office. The future of healthcare is promoting health and wellness. It's telehealth.
We provide access to patient portal, giving them access to their own information on patient portal to empower them to control their own health, sort of their own destiny.
Today we are saying we're going to treat you comprehensively, look at you and say, what are all of your needs?
We've been able to be bold and innovative in the ways that we care because generous donors and funders just like you have believed in our mission.
As a donor, I want to say thank you.
This is about what you do to help us reach the folks in our neighborhood, in our community. really the driving force here is that there's consistent growth and progress being made.
This is how it should be. People helping each other and providing the best to each other.
This is not about Humboldt Park Health any longer. This is about the community. It's about the people who we serve.